What is the difference between seizures and epilepsy? When we talk about seizures, we talk about an abnormal brain discharge. I tell my patients that seizure is a symptom of an underlying disease. Epilepsy, on the other hand, is a brain condition characterized by unprovoked and recurrent seizures. What causes epilepsy? One way of answering that is to look at the way seizures or epilepsy is classified. The most common classification is to determine the onset or what part of the brain is provoking the seizure. We talk about focal epilepsy, meaning that there's an abnormal part of the brain that causes seizure, versus generalized seizure, meaning that both sides of the brain are firing abnormally, giving rise to the seizure. What are factors triggering seizures? When we talk about seizures, we talk about the seizure threshold. Anything that can lower the seizure threshold can potentially induce seizures. This includes sleep deprivation, fatigue, intake of medications, including psychotropic medications, can lower the seizure threshold. You could also induce seizures when people use alcohol or illegal drugs. Obviously, there are also metabolic problems like low sodium, high fever that can cause seizures in epileptic patients. The diagnosis of epilepsy involves several steps. We start with a comprehensive history and physical examination, which is the single most important part of the evaluation. Other diagnostic tests that we do includes an EEG, which is a test that looks for abnormal brain waves. Neuroimaging in the form of a head CT scan or a brain MRI is important to look for anatomic causes for the seizure. When patients have epilepsy, the mainstay of treatment is using anti-epileptic medications. Currently, there are about 14 of these available in the market. We also use things like a ketogenic diet, which is useful mainly in babies or kids, which involves the use of a high-fat diet to try to reduce the number of seizures. It is possible to live a normal life with epilepsy. 60% of newly diagnosed epileptics become seizure-free on the first anti-epileptic medication. 70% of this will eventually be able to wean themselves off the medication. I tell my patients that you are a patient with epilepsy. Epilepsy does not control your life.